I'm Sylvia Arenas. I'm a county supervisor and really proud to represent this district and, of course, St. Louis Hospital. In my eyes, the County of Santa Clara is responsible to protect those who need the most protection. That is exactly what the SAFE programs do in following instances of gender-based violence. I've been doing this as a council member for the city of San Jose, and I'm really proud to be doing this once again as a county supervisor. And really the people who work with me have worked with me across the jurisdictions. And the people that you see next to me, Kim Walker, for example, and the council member, the mayor, the chief, and the chiefs, they all have a part to play in this. Because without us all communicating and coordinating together, none of this would really exist. And the success of programs like this, the SAFE program, wouldn't be so effective. And this is what we really want, is a place for people to come, feel safe, and be able to collect evidence, which I'm going to talk a little bit about. We'll just get a little technical on some of the things that we actually do here. And I see in the audience a lot of folks who actually work with our survivors, who support our survivors, who are there, part of that network that is so important once these incidents actually happen. And unfortunately, we have noticed, and I as a council member, I served for 6 years, and every year that I served, and I was in a public safety committee, every year I would see there was an increase in gender-based violence. And we need to figure out what is it that we are going to do collectively as a city, but more importantly as a community, because we have a sense of responsibility to everyone. All genders are included in these statistics. Unfortunately, those who identify as women and young girls are at the top of the list. And unfortunately, on top of that, most of them are brown. They're Latina young girls and women who identify as such. This is why these free SAFE exams are just absolutely so important. It's something that we do within 10 to 14 days after an assault. So if a survivor would like to have evidence collected, it doesn't mean that he or she is committed to going through all of the legal process, but at least the collection is there, and when that survivor is ready, they can then participate in that legal process part of that program. The other important thing, and as I noted, there's a lot of folks here who already work with survivors. You do this on a daily basis. You're part of what makes these survivors really safe in our community. It starts here with St. Louis Hospital with the SAFE exams, and that's a sexual assault forensic exam. The acronym is SAFE, and so fitting, isn't it? And then we hand them over to all of you who are in our network and in our community. And this multi-jurisdictional network is so effective because we continue to stay connected, we stay in communication, and we have really the same purpose, and that's to respect the Bill of Rights of sexual assault survivors. It's really what unifies us, and the County of Santa Clara has adopted the Bill of Rights, and I hope all of our cities will continue and follow in suit. I'm going to make sure, and I know our Board of Supervisors already are on board, but I will continue to make sure that our hospitals and our systems remain responsive to the acute needs of survivors, and that the voices and the leadership of survivors in our community are at the forefront. We want to make sure that we are respectful. If you live in Santa Clara County and are experiencing gender-based violence, please visit a SAFE response site immediately and ask for a safe nurse. Our nurses are already safe, but people will understand if you call it a safe nurse. And the phone number is going to be easy. It's 408-793-SAFE. So 408-793-7233 for immediate assistance. Thank Thank you, everyone. And I would like to welcome Gloria de la Merced, who, without her leadership, this safe response location wouldn't be possible, as well as this wonderful hospital system that supports all of our community. Thank you.
All right. Thank you, thank you, Supervisor Arenas. Santa Clara Valley Health Center's Sexual Assault Forensic Examination, in short, SAFE, our team has expanded its program by performing medical forensic exams for sexual assault at St. Louise Emergency Department. And I would like to acknowledge Dr. Dan Nelson and Dr. Saavedra, who are here, part of the emergency department team. And so with Marta Olvera, who's the nurse manager in the emergency department. These services are particularly timely, as this has been a high priority for the Board of Supervisors and our Santa Clara Valley Healthcare executive team. We already started operating since July 5th as a soft launch, and then today we're going to have like an opening program. And it operates 24 hours a day with specially trained SAFE nurses on call to perform the exams for patients presenting for sexual assault, domestic and intimate partner violence, and human trafficking. St. Louis is now the South County response location for the Santa Clara Valley Healthcare SAFE Program. This program will serve Morgan Hill, Gilroy, San Benito, and other surrounding counties. And this new location at St. Louis, which is, again, we made history. This is our first time ever for the South County, which is really great. Yeah. So this new location at St. Louis will ensure survivors have access to trauma-informed care across the county within 1 hour of their arrival. And to cater to the holistic needs of our patients, we will offer timely medical attention, and we will also establish dedicated private showers and confidential spaces for patients away from the ED. Our SAFE patients will also be provided access to necessary medications and other essential necessities. This commitment to serving our community was not only a practical decision, but also resonated deeply with the mission and goals of St. Louis. So our dedication to comprehensive care and patient-centric services made this prioritization an obvious choice. This endeavor wouldn't have been possible without the unwavering support of Supervisor Arenas. Thank you very much. And the Board of Supervisors. I know Catherine's here from Supervisor Simitian, and Santa Clara Valley Healthcare. So their support has been instrumental in turning this vision into a reality, one that aligns seamlessly with our mission and demonstrates our dedication to community welfare. With that said, thank you very much, and we'll have the next speaker.
Good morning, my name is Kim Walker, and I'm the nurse manager of the Sexual Assault Forensic Exam Program, also known as been said before, the SAFE program. I am a SAFE examiner. I have been one for 14 years now, and I am running the program with the additional 30 nurses that we have. We have specially trained nurses that are able to respond within 1 hour of call-in to a case at multiple locations now in Santa Clara County. We see the patients who are 12 years and older within 10 to 14 days after sexual assault, after intimate partner and domestic violence, certainly after strangulation and human trafficking. We, in Santa Clara County, with the establishment of this location in the South County in Gilroy, we now have 3 locations that we are able to see patients across the entire county in the effort to make sure that we are responding to the patients rather than them responding to us. Giving the extra burden to survivors to have to come and find us and get care has been something that we've wanted to move away from. We've always had a central location in San Jose where we've been able to see patients and provide a full complement of services, and that includes head-to-toe medical assessment, forensic evidence collection, medications for emergency contraception and sexually transmitted infections, and certainly then communication and coordination with the services available. YWCA and Community Solutions, particularly Community Solutions in the South County, are of incredible importance to a survivor to be able to have confidential advocates on site at the same time we're doing the exam. Making sure that we're connected to law enforcement so that they can provide security and comfort, and making sure that they have the investigation in a timely manner is also important. We collaborate with all of the services locally so that we can make sure that no matter where a survivor enters the system, that we all understand the same workflows and we can all make sure the patient is shepherded kindly, respectfully, and in a trauma-informed manner throughout the process. So I want to say thank you very much to Gloria, to administration, to the Board of Supervisors, those who are here and who can't be here, who've been strong supporters, and all of the law enforcement that showed up. San Benito is also here, and I do need to have a shout out because we do cover San Benito. They will be using this South County location as well. So thank you all for being here. I really appreciate your time, and definitely want to thank again all of those who put in the effort to make this happen. Thank you.
Good morning. I'm Gilroy Mayor Marie Blankley. Proud Gilroy Mayor to have this hospital right here in Gilroy. I don't feel like it's been said loudly enough, maybe because it doesn't feel loud, but I'm known for being loud, so I'm going to say it again. Sexual assault forensic examination. What a program to have here locally. And it's only been a little over 4 years that this hospital was even saved, we're going to call it. I didn't think it would be as difficult to keep our hospital going as it turned out to be. Thank goodness the county and the supervisors really fought hard to make this a county hospital, because a private one wasn't going to make it. It just wasn't surviving financially. And so this is our hospital that we should all be very proud of, and the expansion of programs like these available here in South County should be something that we all stop and reflect on and appreciate, because it's such a big deal. And when I think about the number of people that it can help, it's not just adults. I mean, unfortunately, this affects children too. These kinds of examinations are necessary. It's a hard thing to not want to make easier on the victims. And so this is something that maybe we can do to make things just a little bit easier. So I'm really trying to stress the importance of regional hospitals and regional locations, smaller regional hospitals and locations that people can access. The specially trained examiners of the SAFE program treat sexual assault survivors with dignity and compassion. We need to ensure that these examiners are available countywide. That's why I am so very grateful that this is now available here at the St. Louise Medical Center. Thank you.
Good morning. I'm Gino Borgioli, Morgan Hill City Council, and on behalf of the Mayor of Morgan Hill, I want to just thank you for coming this morning and being a part of this great program. Della, thank you for your leadership in this SAFE program, which is so badly needed in the South County, actually all over California, but we're honored to have it in the South County. And having these protective programs like this in our communities only elevates the quality of life for our residents. And that's what we're all about as cities and counties, elevating the quality of life. These types of cases are rising in the South County, and where are these programs? Well, now we have a program. 4 years ago, we promised, not we, but the county promised to keep DePaul Center as a medical facility, and they kept their promise. And you know, just having all these programs available to the South County residents is just a huge part of, again, I keep on saying quality of life, but that's really what we're trying to do. So again, Della, thank you so much for your leadership. Thank you all for being here this morning to kick off this wonderful program. Good morning.
Well, good morning. I'm Pedro Espinosa, Chief of Police for the City of Gilroy. And on behalf of the men and women of the Gilroy Police Department, we thank you for the partnership. Thanks to St. Louise and Santa Clara Valley Medical Healthcare, and really the commitment of the Board of Supervisors and Supervisor Ardenas for taking the interest and investing in South County. You know, and it's unfortunate that we have a need of centers like this, but the reality is that that is the world that we live in. And as a law enforcement entity, I and the men and women of the Gilroy Police Department stand in solidarity to ensure that survivors of sexual assault, intimate partner, and gender-based violence are treated with dignity and respect. And now that we have the SAFE Center in South County, it'll allow us the capacity to expeditiously coordinate those resources for the survivors, and that we gather the evidence, and as first line of us seeking justice on behalf of survivors, that is certainly going to facilitate that process. So I commend you, I thank you, and we are certainly elated. And again, it's an unfortunate need, but we are happy that we have it down here in South County. So thank you very much.
Hello, my name is Shane Palsgrove, Morgan Hill Police Chief. On behalf of Morgan Hill Police Department and we are happy that St. Louise Regional Hospital is offering South Santa Clara County a sexual assault response team. This has tremendous benefits for our survivors and our community. As a prior sexual assault detective, I'm very familiar with the benefits of having a local team. Local access is another step in improving support for our survivors. Local access, or the proximity of having a local sexual assault response team, provides local connections and resources with our community-based organizations, keeps officers in our community, provides a faster, more efficient response, and allows family and or friends easier access to provide support to our survivors. Survivors can access this free service by calling our police department, making a police report, contacting our Family Justice Center, calling Community Solutions Sexual Assault Hotline, or visiting hospitals that have a SART team, such as Valley Medical Center, St. Louise Regional Hospital, or Stanford hospitals. The availability of multiple pathways to access SART services reflects our county's survivor-centered approach to addressing sexual assault in our community. It recognizes that survivors may have different needs and preferences in seeking help, and ensures that support and advocacy services are readily available to assist survivors on their journey toward healing and justice. Thank you.
Good morning. I'm Lisa De Silva, Chief Development Officer of Community Solutions, and I'm really here speaking to you this morning as a founding member of our sexual assault services. And this day is so exciting because it really is more than 40 years in the making. On October 20th, 1981, we opened our sexual assault services hotline. And soon thereafter, we as advocates were accompanying survivors up to VMC for the SAFE exams. And let me share with you what that meant in those days. First of all, it was the same as now, up to a 35-mile trip each way. Sometimes it was in the advocates' cars in those days, sometimes in the back of the police car. That added to the trauma that the survivor was already going through. We often had to wait when a private space couldn't be found by the nurses. We were waiting in the emergency room, in the chaos, in the noise, and all of the activity in the emergency room. That added to the trauma. We, of course, were triaged, kind of low on the list when you have gunshot wounds and drug overdoses and heart attacks. So that often meant 4, 5, or 6 hours that we were waiting there. That added to the survivor's trauma. So it was a really difficult process on what was already the worst night of her life. And being able to now have those services locally makes such a difference, because it means that, first of all, the time is so much less. It means that the exam itself can happen so much faster. And most importantly, it means, because of all of those things, that the healing can start sooner. So from Community Solutions, through all of us, to all of our partners, we have such heartfelt gratitude for everyone who's worked so hard to make this a reality. Thank you.
Good morning and thank you. It's really an honor and a privilege to be here for the opening of vital services in the South County. This is a testament and a sign of Santa Clara's ongoing and profound commitment to trauma-informed and evidence-based response for gender violence and domestic violence and sexual assault. Back in 1987, VMC and the county opened their forensic medical exam program for victims of rape and sexual assault. And in 1991, I was brought to VMC and received those services. Good morning, I'm Michelle De La Calle, a colleague to many people here, a nurse, a mother, a daughter, and most importantly and relevant today, I'm a 30-year-plus survivor of rape and a former patient of Santa Clara County's first SAFE program. So although it may sound a bit counterintuitive, I was lucky to be raped here in Santa Clara County, in this county, where the responding police and ambulance knew where to take me. The team at VMC knew how to respond, and I needed that. I needed to be believed, and I needed to be heard. What happened to me felt unreal and was unbelievable. The team made me feel safe and supported. They allowed me to take back control and asked me for my consent, my approval. They were compassionate and in a stark contrast to my assailant, who disregarded my words, my resistance, and my body. The team allowed me to regain my power and skillfully collected vital evidence and photographs that enabled my assailant's ultimate conviction, as DNA linked him to the crime and photos showed my lack of consent. So today I stand here with gratitude, with compassion, and with pride. It's not easy to stand up here and talk about it. I never wanted to need safe services, and I did. The team was there for me, and now the team will be here for the South County and beyond. So thank you.
Thank you, Michelle. Really appreciate that. Anyway, well, thank you. Before we close, I would like to acknowledge our St. Louis team who are here today. Dr. Laura Tribusi, our ED Medical Director. And I would like to call on Dr. Olivia Lee. She's our Physician Executive. Can you stand up? And Dr. Ray Rosario, our Healthcare Service Line Director. That's part of our executive team. And on behalf of Paul Lorenz, our Chief Executive Officer, who cannot be here today, but he's sending his regards to everybody, and thank you. And also to everybody, the Gilroy Police Department, Morgan Hill Police Department, Mayor, and everybody else, St. Louis employees, and really appreciate your presence. And Supervisor Arenas, thank you so much for your time. I know you have a very important event today, her son's birthday, but she gave us a few minutes of her time today. So again, thank you everyone, and please, you're welcome to our refreshments and after the program. So thank you all.